Hello, my name is Cameron Hubbard, and I'm a fourth-year medical student at the Michigan State University College of Osteopathic Medicine. This presentation is on the effects of motion-style acupuncture treatment in acute low back pain patients with severe disability. Just to offer some background on the project, acute lower back pain is often characterized as a relatively benign process with a brief course and spontaneous resolution. There are, however, significant number of patients that continue to experience relapsing and remitting symptoms, which can often lead to avoidance behaviors and a progression towards a chronic lower back pain. Prior studies in acupuncture have demonstrated effectiveness when targeting chronic lower back pain. However, there has been little to no evidence to suggest any benefit in the acute setting. The authors of this study sought to examine a potential role for motion-style acupuncture treatment in patients with acute lower back pain. The study was done via a comparison to NSAIDs, which is considered to be a mainstay of treatment with proven efficacy in acute lower back pain. For those unfamiliar, MSAT itself involves active movement with curtailed assistance while performing acupuncture at 3 key regions, which you can see in the diagram on the side. Patients are encouraged to maintain activity for the duration of treatment or until they can walk without assistance. The study was performed as part of a multi-center randomized clinical trial with parallel arms. Persons aged 20 to 60 years old with acute lower back pain, which is defined as being less than 4 weeks in duration, as well as an Osteopathic disability index of greater than 60% were included in this study. Exclusion criteria included those with acute lower back pain that could be explained by severe ongoing illness, such as malignancy. For the control, patients were administered a single dose of diclofenac 75 milligrams, which is injected into the gluteal region. The experimental group received a standardized treatment with MSAT for up to 20 minutes, dependent upon patient need. Patients received pre-treatment assessments in both primary and secondary outcome measurements, as well as similar follow-up at 30 minutes, 2 weeks, 4 weeks, and then at 24 weeks. The results showed, after a total of 58 patients had been enrolled, and this was obtained using a mean and standard deviation with an independent t-test that's set to a 95% confidence interval and a p-value of less than 0.05 for significance. As you can see from the first chart, the Numerical Rating Scale, which is the primary outcome measurement, showed significant improvement at 30 minutes when compared to control. This improvement continued into 2 and 4 weeks, however failed to show any significant difference at the 24-week marker. In the second chart, similar trends were observed in the secondary outcome of the ODI. The authors also noted an improvement at the 30-minute marker for both independent testing and straight leg raise in the patient's global impression of change score. However, these failed to show any significant changes at weeks 2, 4, or 24, and that for that reason were not included. Prior studies have suggested that a change in numerical rating score greater than 3.5 or an ODI of greater than 10 would qualify as a clinically significant reduction in acute lower back pain. As this study reported, there was a change in MSAT of 3.83 and an ODI of 33.37, with a continuous trend that suggests MSAT is more effective in relieving pain and restoring function in the first 4 weeks when compared to NSAIDs. In conclusion, the findings showed promising results for the use of MSAT in acute lower back pain and further suggested some potential applications in treating patients with herniated disc, as this was discovered by incidental imaging reports during the screening period. Furthermore, the authors found that the use of MSAT therapy resulted in fewer hospitalizations and a decreased length of stay at 93 versus 66%, as well as 19 days versus 27 days, as you can see here in chart number 3. Among the potential concerns in this study are: 1, patient treatment options were not regulated during the follow-up period. This could present multiple confounding variables on self-reporting. And 2, the authors themselves suggested that patients who sought Korean medicine may be more biased towards the success of MSAT treatment, and posited that a pre-screening favorability assessment may have been beneficial for uncovering biases. And finally, 3, there may be potential cognitive bias towards MSAT, given the duration of treatment and the physician contact time, which could lead to increased satisfactory reports versus NSAID injection, which is more brief and involved limited interactions. That concludes this presentation. Thank you for your time and attention.